Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? And nice to meet you, Mr. Abdullah. May I know what brings you here today? Okay. Anything else? I'm very sorry to hear about it, Mr. Abdullah, and I totally understand it. How this is affecting your life. Before I come to the management part, I'll ask you a few questions. Is it okay with you? Thank you, Mr. Abdullah, for your cooperation. So, Mr. Abdullah, can you tell me about your appetite? It is increased. Okay. How about your weight? It is decreasing. Do you have boils frequently? Okay. And do you feel like stretching, especially in your private parts? Okay. Have you noticed like your eyesight is reduced? Do you feel any numbness in your arms and legs? Especially tip of fingers and toes? Do you have any urinary problem? Do you have any bowel problems? Okay. Did you have any heart problem? Any history of paralysis? Do you feel any weakness and wasting of your thigh muscle? If you are married? Okay. How's your sexual life? Okay. Do you suffer from bloating as distension after eating? And do you feel dizziness on standing from sitting position? Okay. Can you tell me, do you feel a pain while passing urine? Do you feel you have to rush to toilet and have feeling of incomplete abdomen? Okay. And how about your mood, Mr. Abdullah? Okay. Okay, Mr. Abdullah, I'll ask you a few personal questions. Is it okay with you? Okay. Do you smoke? How much? Okay. Have you ever tried to quit smoking habit? Okay. We'll talk on it in the next appointment. Okay. Do you drink? Okay. Is there any history of high blood pressure? Okay. Okay, Mr. Abdullah, what do you do for a living? Public bus driver. Okay. Okay. And how are things at workplace and things at home? If you are taking any medication prescribed by doctor or over the counter? Only metformin. Okay. And so do you have any allergies? Okay, Mr. Abdullah, can you tell me if there is any medical problem in immediate family member? Okay, so Mr. Abdullah, let me summarize everything again, and that you can hear that for your uncontrolled blood sugar, as you are diabetic since last 2 years, and you have noticed your vision is reduced and you feel numbness in your arms and legs, and your appetite is increased, but despite that your weight is decreasing. And is there anything else you would like to add? Okay, Mr. Abdullah, in order to better understand, I would like to examine you. Is it okay with you? Thank you, Mr. Abdullah, for your cooperation. Kindly come on the couch, and then I'll do the general physical examination. I will look at the face of the patient, and then I'll ask him look down, look up, and then I'll check face for the puffiness, and then neck for nigricans, any skin tone change, and any cyanosis. And I'll check the fingers and for cyanosis, for numbness, and for any ulcer. And then I'll check the foot of the patient if there is any wound or ulcer, and I'll check tips for numbness, and I'll check index. I'll check the pulses, and I'll check the pressure with monofilament, and I'll ask patient to close his eyes, and then I'll ask patient which toe I'm moving, and then I'll check the skin if it is dry, moist, or color, if color is changed, and then I'll auscultate the chest, and then heart. Thank you, Mr. Abdullah, for your cooperation. And on the beginning and end of the examination, I'll sanitize my hands. And okay, Mr. Abdullah, I'll offer you the following investigations. Okay, but before I offer you, let me ask you if you have undergone any blood test recently. Okay, so yeah, I'll ask you few investigations. Okay, here is the blood and sugar fasting and 2 hours after meal, and here is the HbA1c level. Okay, and complete lipid profile, and urea create and electrolytes with EGFR. Okay, and ECG. Is it okay with you? Okay, and now let's do the management part. And I'll divide management into non-pharmacological and pharmacological. Okay, so let's talk about non-pharmacological management first. So Mr. Abdullah, you have uncontrolled type 2 diabetes mellitus. So I'll strongly recommend you to follow lifestyle changes and regular exercise. And can you avoid simple carbohydrate and sweet things like sugar, honey, Coca-Cola? Because 50% of calories should come from fiber-rich complex carbohydrates like potato, brown rice, whole grain. And can you do it for me? Okay, and your food should have at least 5 portions of fruits and vegetables, and reduce fats to minimum, especially saturated fats. Can you do it for me? And yeah, let me remind you that no red meat, poultry, okay, and oily fish is good. Okay, and try to reduce salt intake, and you need to stop smoking completely. Okay, can you do it? Okay, and spread the food evenly across the day, and you don't need any separate diet from rest of the family. Okay, no expensive diabetic food products. And the diabetic diet is healthy diet. Okay, and try to do some regular exercise, 150 minutes per week, or you can divide it into 30 minutes per 5 days a week, and you can have 2 days holiday. You can do exercise in the form of brisk walking, cycling, swimming, jogging, okay, or any other game. Okay, and remember, exercise decrease weight, and reduce your blood pressure, and decrease lipids, and improve blood sugar control. And can you manage it? And yes, Mr. Abdullah, I'll offer you influenza and pneumococcal vaccination. Okay, it is necessary. Okay, as you know, diabetes mellitus is immunocompromised state. Okay, and I offer you my assistance in quitting smoking. Okay, and please inform DVLA and insurance about your type 2 diabetes mellitus diagnosis, unless diabetes mellitus controlled by diet alone. Okay, and you can no longer drive public service vehicle or heavy good vehicles because of possibility of low sugar attacks, especially if they occur frequently. Okay, and check fasting blood sugar before driving and every 2 hours during a long journey, and supply responsible member of family with glucagon injection. Okay, is everything clear till now? Okay, and I'll ask you self-monitoring. Check your blood sugar at home pre-meals and at least once a day at different times, and keep a record, and keep HbA1c at least 2 times a year. Okay, and let's come to the pharmacological management. As your blood sugar is uncontrolled, hence I offer you to increase the dose of metformin to 1000 mg thrice a day, and add sitagliptin 50 mg once daily. Is it clear till now? But yeah, let me remind you about the safety netting. That remember, metformin can cause some tummy pain from bloating. So we will review your blood sugar every month and keep increasing the dose until satisfactory control is achieved. Is it okay till now? And I'll offer you a follow-up visit after 1 month. Is it convenient to you? And yeah, kindly keep wearing Alert bracelet or necklet, and teach your family and colleagues about what to do if you develop hypoglycemia. Okay, is everything clear till now? And I'll ask you to I'll refer you to ophthalmologist for eyesight checkup. Okay. And although diabetes mellitus is a progressive disease, but rest assured, if you keep a good control of your blood sugar, you can delay complication by decades and live a very normal, healthy life, a long life. Okay, is it clear till now? Should I repeat everything again for you? Okay, Mr. Abdullah, I wish you a speedy recovery and take good care of yourself. Bye-bye.